So cool sculpting is a procedure that we started in the infancy of the companies. We've had cool sculpting for about as long as any practice in the United States. And the way I think that we look at cool sculpting is if you have isolated areas of fat that need to be removed, whether that's bra fat up on the arm, on the side of the chest wall, saddlebags, kind of muffin tops, that are very specific areas that are out of proportion, cool sculpting can help with that without having to do surgery. Whereas if the pockets of fat are larger or more extensive, then that's when you tip over into needing to do a surgical procedure like liposuction.
Cool sculpting essentially has no downtime. So you could have the procedure, go back to work, go exercise that afternoon. Whereas even small areas of liposuction, you're going to have some downtime. You know, we'd ask you probably not to exercise rigorously for a few weeks after liposuction. The main difference is the amount of fat that you can remove at one episode. Cool sculpting's limited to the size of the handpiece that you use, whereas liposuction, you're just limited by safety factors of what's the safe amount to remove in one sitting. So I agree with Dr. Thornton. Liposuction is better for people who have kind of generalized fat deposits and large amounts, whereas cool sculpting is better for people that are generally fit and have isolated areas of fat that you can treat with limited fat removal with cool sculpting.
So, you know, cool sculpting, over the years, it's evolved with more handpieces. So there are little small devices that basically have cooling plates inside. And you place it over what we would call a target area, so where someone has a problem with a deposit of fat. And if that's on the lower abdomen, or if that's on the side of the chest wall, or above the bra line, or on the thigh, you place this hand piece on it and basically turn the machine on, and the machine takes the fat and cools it down to a level that freezes the fat and kills the fat. So there's no incision. There's no surgery. It takes about 45 minutes to do the procedure. You can get in your car, drive up, have the procedure done, and go home. Like Dr. Elliott said, you can exercise immediately following the procedure. There's really no downtime at all whatsoever. You see your results over about 2 months time period. So it's a great procedure for reducing fat in specific targeted areas. Now, like anything, you know, if the hand pieces don't fit the area, if there's too much fat in the area for cool sculpting to handle, then that's where we go over into liposuction. And although there's some downtime with liposuction, it's really not much. Most people after liposuction will tell you that they're sore. Very rarely do they tell you that they have much in the way of pain. There can be some bruising, which there's not with cool sculpting, but in the end it's just bruising. It's not anything dangerous. And you can get back to work. You can do it on a Thursday or a Friday and be back at work on Monday. But it's, you know, now with cool sculpting, we're probably seeing liposuction being used for the larger, more complicated cases, or cases where the sculpting is very important and the machine, called cool sculpting, can't really sculpt as well as we can sculpt if we really need to, you know, reshape a body or reshape an area like the hips or the buttocks. You know, cool sculpting has been a wonderful addition to the practice. It's great for patients. You know, it really does have nice results. It works. It can be repeated. There's no downtime. There's all these great things about cool sculpting, and a reason that we have offered cool sculpting for many years now. But, you know, in the end, sometimes we really do have to sculpt, and we really do have to change the shape of hips or buttocks or thighs. And the machine of cool sculpting with the hand pieces can't do that. And that's when we have to come in, you know, with what we are, you know, trained and specialized to do to get somebody the shape and the size that they want.
I mean, cool sculpting is basically a suction device. So you put the handpiece on the area you want to treat, and it sucks the fat in to the handpiece. And each side of the handpiece has a cooling plates and it freezes the fat that's into the handpiece, and then it gets it so cold when it comes off, it almost looks like a Jell-O mold where the fat is still in the shape of the handpiece when you take it off, and then that quickly goes away. But it gets cold enough that it actually kills a certain percentage of the fat cells, which then your body over time absorbs and gets rid of. Liposuction sucks the fat out directly, into a container, then you can see it. The big advantage of cool sculpting is just that there's no surgery, no downtime, whereas even limited liposuction, there'll be at least a small incision, and there will be some downtime involved with it. So that's why cool sculpting has become so popular. Cool sculpting is, in my mind, intended to be, for most people, a one-time visit for one area. Now, if a person had a couple of isolated areas and they wanted to do those on separate days, that would be fine, but your aim is to treat that area once. Because once you've treated an area with cool sculpting, you can repeat it, but once you've done it a bunch of times, that patient may have been better off financially just doing liposuction once versus cool sculpting 2 or 3 times. So if I think somebody's going to have cool sculpting more than 2 times, I'll probably advise that person and steer them more towards liposuction, because I think it's a better option for those people.
Yeah, I agree completely with that. When you have an isolated area, it's nice if we can do cool sculpting one time. Oftentimes, or sometimes, it may take more than once, and I think 2 times is acceptable, just like Dr. Elliott said. But what they're weighing is price and cost of the procedure, as well as having surgery. And so, some patients, might be able to have 3 episodes of cool sculpting and equal what we get with liposuction, but the cool sculpting actually ends up more expensive than liposuction. Now, if the patient is okay with that and they're just adamant that they don't want to have, a slightly more invasive procedure, liposuction, then that's fine. But, like Dr. Elliott said, there's clearly times when liposuction of one person's needs can be much less expensive than what it would take with cool sculpting. And, you're repeating that procedure multiple times on multiple days in that case, whereas we can go in one day in liposuction and have it done and over with. So arguably in those patients, we can get the results quicker with liposuction for a cheaper price than cool sculpting. But at least cool sculpting gives the patient a non-surgical option if they're adamant about it, that they can.
Right. The other side of that coin is somebody that has a small area and they want to definitively make sure that that is removed, they could opt for liposuction under local anesthesia, have a small procedure, and we could go in there and take care of that. So that you could have it both ways. Somebody that you might favor liposuction that does cool sculpting, and the opposite could happen. Somebody that you thought would be good for cool sculpting, they just say, well, look, I'd like to just be 100% sure that I've got this taken care of. Let's just go ahead and do a limited area of liposuction. So, and all of that's fine, and that's why you have to actually talk to the patient and kind of get a feel for what they want. You just don't tell them what to do necessarily. You kind of listen and get an idea of what's best for everybody.
And I think that's what's important, with seeing a plastic surgeon that we are very adamant about and very passionate about, is we want patients to have choices. We are trained and for 20 years or more have been doing liposuction. It's a great procedure and it works very well on people. But, there are new procedures out, like cool sculpting, that work that you can avoid surgery. And if you go to a clinic and they offer cool sculpting, but that's all they offer, guess what? The answer to remove your fat 100% of the time is going to be use cool sculpting. But the fact is, it's not always the answer. Oftentimes it is. And the best thing that we can do is have a good consultation with you, talk to you to see what is best for you, what fits the results that you want the best, what fits your decision on whether you want surgery or not the best, and in the end, make you a happy patient and give you the result that you want. And the best thing that we can offer is a good consultation with a choice of what procedures are going to work best for you.
And so there are people that there isn't a wrong answer. Either one could be right. Yeah, you just have to figure out, based on their lifestyle, their expectations, which one would be the best for them. And then there's people who really are liposuction, and then people who you would really push towards cool sculpting. But a lot of people, you know, you could
Go either way.
Could go either way.